Good day everyone, I am Shantime M. Tuban and I am going to discuss about mammary glands events of embryonic and fetal development. So mammary gland is a modified sweat glands primarily functioning in women. So the main purpose of mammary gland is to produce milk to nourish newborns. So hormonal influence, stimulation by female sex hormones, especially estrogen, during puberty, which help develop the breast. So which you can see the alveolar ducts that surrounded the breast. So what is the primary function of mammary glands? A. To produce sweat. B. To produce milk for nourishing newborns. C. To regulate body temperature. And D. To store fats. The answer is letter B. To produce milk and for nourishing newborns. So that was the primary function. So So the mammary gland is located in the skin-covered breast, which is anterior to our pectoral muscle. Mammary glands is both present in male and female, but it is only functional in women. So one of its part is the areola. So areola is the pigmented area surrounding the nipple, which contain small glands that lubricates during breastfeeding. So which you can see here, the areola. So next part is the nipple. So nipple is the protruding structure through which milk is delivered to the newborn. So that was really a functional one. So this is where the nipple located, just in top of the areola. The next part is the lobes and lobules. So each mammary gland contains 15 to 25 lobes that surrounded our breast. So these lobules contain clusters of alveolar glands that produces milk. So this is our mammary gland. So the internal structure and diagram of mammary glands. So the main function of mammary gland is to produce milk. So we should know that the alveolar gland within the lobules, which is produces milk when a woman is lactating. So this process is stimulated by the hormone which is called prolactin, which plays a bigger part in it. So the next part is the process of milk transport. So the process begins when the milk is transported through a network of lactiferous ducts which covered the nipple. So each lactiferous duct has dilated region called the lactiferous sinus, which accumulated during nursing. Question number 2. Which of the following is not a key component of mammary gland? A. Areola. B. Lobules. C. Testes. D. Nipple. The answer is testes. What is the role of lactiferous ducts in mammary glands? A. They produce milk. B. They transport milk to the nipple. C. They store fat. D. They regulate hormones secretion. The answer is letter B. They transport milk. So homeostatic imbalance of mammary gland. Breast cancer. Breast cancer is a disease in which abnormal breast cells grow out of control and form tumors. If left unchecked, so this can be very fatal and spread throughout the body. So this is one of the example of tumors. So in statistic, breast cancer is the second most common death in American women, with a ratio of 1 to 8 women will develop breast cancer. Question: which genetic mutation are most commonly associated with an increased risk of breast cancer? A. BRCA1 and BRCA2. B. X-linked mutations. C. APC mutations. D. P53 mutations. The answer is letter A, BRCA and BRCA2. So these are the risk factor of breast cancer. First is the age. The risk of breast cancer increases within the age of 50 or after 50. And in genetics, inherited gene mutations in genes like breast cancer 1 and breast cancer 2 and then POB2 can increase the risk of breast cancer. Next is reproductive history. Starting menstrual periods before an age 12 or starting menopause after an age of 55 can really increase the risk of breast cancer. Next is the breast density. Women with a dense breast are more likely to get breast cancer. Next is personal history, either having a breast cancer or certain non-cancerous breast diseases increases the risk of getting breast cancer again. Next is family history, or having a family history of breast cancer can really increase the risk of breast cancer. Next is the radiation exposure, so having a radiation therapy to the chest or breast before age 30 can increase the risk of breast cancer. Next is lifestyle, being overweight or obese, being physically inactive, drinking alcohol, and eating poor diet can really increase the risk of breast cancers. So next is chemicals. So exposure to chemicals in food, lawn and garden products, plastic products, sunscreen, and drinking water may really increase the risk of breast cancer. Next is hormones. So taking hormones, including some oral contraceptives, can increase the risk of breast cancer. So it is really important that we should maintain our body physically fit. And also monthly checkup. So early detection of breast cancer is really important in improving our survival rates. So we should as women, we should be aware of alterations in skin texture in our breasts, including puckering or dimpling, and also unusual discharge such as something white or red. It's indicate breast cancer, and it is one of the symptoms. So detection methods. So regular screening is essential for early detection. So one of the procedure is the mammogram procedure, which is an x-ray of your breast. So in breast self-examinations, women are encouraged to perform monthly self-exam to identify any unusual lumps or changes. So the American Cancer Society recommends that women aged 40 to 49 have a mammogram every 2 years and year thereafter to detect breast cancer that may not be palpable. 5. What is the recommended frequency for women aged 40 to 49 according to American Cancer Society? A. Every 3 years. B. Every 2 years. C. Yearly. D. Every 5 years. The answer is every 2 years. Next is introduction to pregnancy and embryonic development. So these are the definitions. So fertilization is the process by which a sperm cell in the egg cell reunites and form a zygote. While a zygote is a fertilized egg that represents the first cell of a new individual. So many would be confused of what is embryo and what is fetus. So embryo is used from fertilization until week 8, while fetus is used from week 9 until birth. And fertilization is the union of the egg cell and the sperm cell, while a zygote is the fertilized egg. So embryo versus fetus. So the term, as I said earlier, embryo is from fertilization to week 8, while fetus is week 9 until birth. So the pregnancy duration is calculated from the last menstrual period lasting approximately 280 days or 9 months. So this is from 1 week conceptus. Then the zygote became a 3 week embryo, and then after that it will become embryo with the size of 10 millimeters. Then after 8 weeks, it become bigger in size, which is 22 millimeters, until the embryo is called fetus, or the 12-week baby. Question number 6. What term is used to describe the fertilized egg before it becomes a fetus? A. Embryo. B. Zygote. C. Blastocyst. D. Morula. The answer is embryo. So the term embryo is used from fertilization until week 8. So next, I'll be discussing about the process of fertilization. So in order to fertilization occurs, it is needed that the sperm cell and egg cell will be reunited. So the oocyte or the egg cell is viable to 12 to 24 hours after ovulation, while the sperm cell can last only 24 to 48 hours in women reproductive. So firstly, the process began during the ovulation, or the ovary will release an egg cell, which is also called the oocyte. After that, the egg cell will travel the women reproductive tract, and then if it encounters sperm, then fertilization occurs. As we can see, the sperm is trying to break the egg cell. Yeah. After that, it will form a zygote, or the fertilized egg. And after 2 days, it will undergo mitosis. As we can see, it was divided 4. After that, a series of mitosis occurs. Then it will called blastocyst, and series of blastomeres rather, is what we call morula. So the morula hollows and fills with fluid after 4 days. So as we can see, it was filled with liquid. And after that, the blastocyst will travel and travel, and implanting occurs, where the blastocyst will bind in our endometrium, or the woman's reproductive system rather. And yeah, so it is really amazing how our bodies work. Fertilization process. So millions of sperm are deposited in the vagina, but only few hundreds to a few thousand will reach the oocyte or the egg cell. Then they will try to break the egg cell. After that, fertilization will occur, or what we call the acrosomal reaction. When sperm reach the oocyte, they release enzymes that help penetrate the protective layers surrounding the egg. Once a single sperm successfully enters the oocyte or the egg cell, fertilization will occur. So it will basically form a zygote. So the cleavage and early development. So zygote will become a morula, then become a blastocyst. That was the real process of it. So, after that fertilization, the zygote begins as a series of mitosis. As I mentioned earlier, yeah, then invite to the endometrium. So, after that, or the morula formation, day 3, the developing embryo is a morula and a solid ball of cells. It continues to divide cells as it travels down the uterine tube. Blastocyst development. So after day 5, around day 5 rather, so the morula hollows out and fills with fluid, and then it will undergo a series of mitosis and forms cleavage. And it was surrounded by trophoblasts. And this is the primary germ layer or the cleavage. This consists of this cleavage. So first layer is the ectoderm, which forms the nervous systems and the skin. Endoderm forms the mucosae and also the associated glands. And the blue one, the mesoderms, gives rise to the most other structure. So this is the overview of the germ layers. So which we can see the ectoderm and the mesoderm and then the endoderm, which is the embryo. And then at the side we can see the chorionic villi, then the umbilical cord, the chorion, the amnion, and also the hollow part is the uterine cavity. So chorionic villi is a projection from trophoblasts, or the one that surrounds this morula that combine with uterine tissues, and the amniotic sac or umbilical cord surrounds the amnion surrounds the embryo, which we can see here. That is surrounds the mesoderm, and then the placenta functionality. So it will begin to make. So the fetal development stages. So from embryo to fetus. So begins at the 9th week of the development. So the embryo after week 8 we will call the fetus. So and also after that the fetus will undergo growth and specialization, then dramatic changes will occur. So in conclusion, this is the important points that really needs to remember. So mammary glands primary function is to produce milk, and then the critical stages of embryonic and fetal development. And lastly, don't forget the importance of breast cancer awareness and early detection. That's all, and thank you for listening. And kindly comment down your opinions about my topic. So that's all, folks. I hope you learned something. Bye bye.